Well, since Kenya reported its first case of coronavirus in the month of March this year, a lot of ground has been covered to try and suppress infection rate as well as the number of fatalities. Nairobi, being one of the hardest hit counties, is somehow coming back to life. And the question is, how do you allow the county to go back to some sort of normalcy while at the same time flattening the curve? Joining us tonight on Inside Government is Nairobi County Commissioner Flora Mworoa. She's here to explain to us some of the modalities that they have put in place to ensure that life gets back to normal in Nairobi and the number of infection is suppressed. Thank you so very much indeed for joining us. I mean, it has not been easy going for you. You joined the county of Nairobi when there was a lot of activities, in regard to the registration of Huduma numbers. Then coronavirus came. How has life been for you?
Thank you, Brian, and thank you, KBC, for this interview. As you said correctly, Nairobi has been hardest hit by COVID-19. It's been quite hectic for the last 6 months or so. In fact, it's only the last 2 weeks that the number of cases have started coming down. But we have had very many strategies to ensure that the numbers come down. I want to say that immediately the cases of COVID-19 were reported, and we realized that Nairobi was the hardest hit, especially with very many people losing their jobs. We went down to work. First of all, we realized that in the informal settlements where most of our people live, there were so many people who had lost their livelihoods. So the government put together a multi-agency committee to identify the needed people within the informal settlements who had lost their livelihoods and they needed some kind of social protection. So we identified people, households rather, and the government was able to give these people money, which is sent through their phones every week. That is 1,000 per week to be able to cater for their needs.
So you're talking about 4,000 shillings per month?
Yeah. And so we have 27,000 people living in the informal settlements who are getting this money up to now, and they will continue getting this money up to the month of September, up to the month of December. Sorry. We also put up a multi-agency committee now to look into the issues of COVID-19. And one of the matters that we have been able to come up with is the addition of health facilities in the city. So we have several health facilities, again in the informal settlements, which were launched by His Excellency the President. We have one in Kibra, another one in Mutuine, we have one in Mathare, we have one in Mukurukwanjenga. All these are level 2 hospitals to be able to, take care of the needs of our people living in the informal settlements. The construction is ongoing, and we will be able to lessen the numbers of people coming to the hospitals that we already have. The other strategy that has really helped our people in the city is the employment of young people, that is the youth, in what is called the Kazi Mtaani. This is a very popular project in Nairobi because we have the biggest number of youth employed in the National Hygiene Program. It's called National Hygiene Program basically because it's about cleaning the areas within which these people live, basically by unclogging drainage, working with the NMS to make sure that the garbage that had accumulated for quite some time has been collected. And basically this was just meant to be a social protection program as well, because these youth earn 450 shillings per day. And now we initially we were paying them per week, but starting last 2 weeks, we pay them after 11 days. In Nairobi, we have 55,000 of them, again drawn from the most vulnerable areas of our city, that is the informal settlements. And apart from keeping our city clean, reducing the rate of crime, our youth have been able to pay rent. Of course, you know, most of them are also parents, as much as we are calling them youth. They have families, so they are able to pay rent, they are able to buy food, and they are very, very, very grateful to government for that.
So, you know, you're talking about a capital city and a county, you know, with almost 5 million people, you know, residing, and 60% of these, you know, living in informal settlements. And this makes, you know, this significant population, you know, more susceptible, you know, to infection. How has it been? I mean, trying to ensure that, you know, these people, they go around their business, their day-to-day business, to ensure that they put something on the table, and at the same time, you know, maintain social distancing, you know, wear a mask and such kind of protocols.
I said that we have a multi-agency committee at the county level, which is chaired by the regional commissioner. I'm a member. We have the Ministry of Health officials from the county, that is from the NMS. We have other bodies like the Kenya Red Cross, of course, and the entire security committee is a member. We have come up with various strategies. One of them is reaching out to well-wishers to provide us with masks and sanitizers, which I have been receiving even up to yesterday. And we distribute these masks mainly to the informal settlements and the sanitizers as well. The other thing that we have done as a committee is to encourage all the administrators at the lower levels to mobilize such committees to be able to go out and, you know, sensitize our people about coronavirus, because again, the few times that I've had an opportunity to be out there, you know, I found the situation very pathetic, because many people will tell you there's no need of having masks, there's no COVID, you know. So our chiefs particularly have gone out there, and you know, they're not able to have the traditional barazas that we've normally had, but they go out, they use speakers to announce to the people around their areas that, you know, on the protocols that they're supposed to observe to ensure that this thing does not spread.
Some people are questioning, you know, the numbers, you know, that are coming out from the Ministry of Health. And the argument is, how is it possible for a county that, depending on how you look at it and the time that you look at it, you know, sometimes has a population of 6 to 7 million people? How come, you know, numbers, you know, somehow, you know, differs, you know, depending on the timings and such. And so people are asking, how do you have a population, such a huge population, you know, in a very small space, and the rate of infection, you're talking about 8,000, almost 9,000 people?
Yeah, up to yesterday, the number of people infected in Nairobi was 19,000.
I mean 19,000.
19,000, yeah, since the first case was announced in the country. And compared to the population that we have in Nairobi, I want to say that we have done our best. Our people have really tried to follow the protocols to be able to have that smaller percentage of our people being infected. And I hope they will continue in the same manner. I believe, apart from those protocols that they have been able to follow, there have been very many other organizations as well, mostly through the COVID National Committee, who have come out very strongly, either to donate food, donate masks, sanitizers, and also spreading the word. So it's really been a very concerted effort from various stakeholders, and I would really like to thank all of them, because it's through all this that we have been able to maintain this number. It would have been higher. Yeah.
And you see, when you look at India, I mean, the number of infection, I mean, is somehow now has gone up significantly in the last 3 months or so. And the slums or informal settlements, you know, are some of the hardest hit, you know, in India. What modalities of or systems have we put in place to ensure that our densely populated informal settlements do not become COVID-19 hotspots?
I have already mentioned some of them. I started with the selection of people to benefit from the cash transfers. Basically, because you see, sometimes if people don't have money and they have lost their jobs, even they may not even have money to buy soap to be able to wash their hands. The other thing that has been done in the informal settlements because of scarcity of water is that in Nairobi, the government has dug over 100 boreholes in the informal settlements in liaison with the Ministry of Water, and they were also launched by His Excellency the President. In every informal settlement, there is a borehole where our people get water for free. So there would be no reason for people not to really wash their hands. And the county government has also been providing soap to the people in the informal settlements. And I mentioned again that when we get a supply of masks and sanitizers, our priority is the informal settlement. Again, of course, there are the level 2 and level 3 hospitals that have been opened, and soon they will be complete to make sure that they take care of the needs of the people in the informal settlements. So basically, I believe the government has done its best. Because our main focus really has been the informal settlements, because we believe that is where, if we have a serious surge of this disease, we would really have a disaster in the city.
And how have you managed, you know, to juggle, you know, between suppressing COVID-19 and catering for the needs of Nairobians, you know, financially, and at the same time ensuring that crime doesn't spiral out of control?
As I mentioned earlier, you see, with the engagement of 55,000 youth, crime has gone down. That is a fact. But of course, it doesn't mean that it has gone down to zero. We still have a few elements, and the other activities carried out by the security agents have not stopped. Of course, there is a curfew. It also, you know, ensures that people are not out there. And, you know, most crimes are committed at night. So the curfew has really been of great help. When I say that crime has gone down, there have been very many other factors that have really helped us to lessen the crime in the city.
Being the chairperson of the disaster, you know, committee in the county, what measures is the county government putting in place to ensure that, you know, there is no resurgence of crime, because a lot of people have lost their jobs in the next couple of months to come?
One of the strategies is that the 55,000 youth that we have engaged, we are training them. By the way, Brian, when we employed these 55,000 youth, we divided them into 2 groups. One cohort works for 11 days. Then they rest, the other one works for 11 days. So what we are now doing with the group that has worked for 11 days is that we have engaged various bodies to train them. Train them on, how to manage the little money that they receive, so that once Kazi Mtani is over, because it will come to an end by January, they just don't go back, you know, to robbery or any other, you know, vices that some of them may have been involved in. They are able to use the money that they receive, you know, to better their lives. Of course, there are many other issues they are being trained on, especially even about COVID-19 itself. So these 11 days that they are on break, they are being trained. So, and we believe that this is going to help them to change their lives for the better. And once now the other group is also on break, we take them for training. So, and we believe that if we are able to change the lives and the mindsets of 55,000 youth, then they are able also to influence others. There are youth who are also called youth champions because they have exhibited some kind of leadership skills, of course without any training. So we have also engaged them to be supervisors for this youth. Every day in the morning before they start work, they take a few minutes to speak to the youth on how they should spend their money, about alcohol and drug abuse rather. So we want this thing to go beyond COVID-19, so that even when lives go back to normal, these people have something to show about kazi mtaani. And I believe this is going to make a change.
Mm-hmm. And so when you're talking about 55,000 youths, being absorbed into the kazi mtaani, plus, the 27,000 that you're talking about that are on, monthly stipends by the government. So in total, you're talking about almost 80,000 people.
Yeah.
And for a county that has almost 2 million people who are considered to be poor, this would be considered a drop in the ocean.
Yeah.
What are the others doing?
I mentioned that there are other organizations that are working with us. I mentioned the Red Cross, the Action Aid. Of course, the NMS has other programs that are also absorbing youth. And in doing routes within the informal settlements, because this is a program that has also kicked off, especially in Embakasi, Mukuru kwa Njenga. And of course, other programs of government have not stopped. For your information, there are people who have been getting this stipend long before COVID. When I talk about 27,000, I am not including those people who are getting a stipend, through the Ministry of Labor.
When you talk to Kenya National Bureau of Statistics, they are saying that almost 1 million people, have lost their jobs. Yeah. And majority of these are in Nairobi. Mm-hmm. Nairobi being the industrial hub of this country. Yeah. I mean, with companies, scaling down operations, companies closing down shops. So the economic impact that a lot of these people are going to feel in the coming days. How do you plan to deal with this? Because these are your people. And
I agree with you, and it is a serious problem. I have personally, seen people who are really suffering. Some people can't even pay rent. And of course, they are not able to be absorbed in kazi mtaani and these programs that we are talking about. They are not even able to get the 1,000. You are very correct. So what I would like to say is that the government has very many other projects. One of them is the various projects that have been there through the Ministry of Youth, and particularly for the young people, because that is where we have the greatest challenge. And the uptake for the loans has been very low. Yeah, the day before yesterday, we had a discussion with the CAS Gender on how to, sensitize our young people about this money. Because up to Monday, we had around 76 million unborrowed for the youth fund. So many of our youth are not willing to borrow this money. But I want to say that we are soon going to have a meeting so that we are able to strategize on how to popularize this project. Of course, many of our youth don't even know that there is such money. Many of them don't even know there is the Youth Enterprise Fund. They don't know. They don't know even what is required for them to be able to even register a group. Many of them don't know, and it is our responsibility as government to make sure that we mobilize them so that they can borrow this money and be able to start up something to support themselves. But I want to applaud the women of Nairobi. They are doing extremely well. they are able to take loans through the Women Enterprise Fund. We are one of the best performing counties, and this is something that we want to encourage. The repayment rate is at 92%, meaning they are doing their businesses and paying back this money. So we have all these projects, and they are the ones that the government has put in place, and we want to encourage everybody to make sure that they participate. This is their money. It is the government funds. They should borrow this money and make use of it. Mm-hmm. Yeah.
We are still yet to get confirmation as to when schools are likely to resume, or classes. I mean, there's still conflicting reports whether it's January or when. But in a county, that has close to 1 million children in school, this, of course, is going to be very hard, trying to ensure there is social distancing, there is wearing of masks, and there is washing of hands. What is the strategy in trying to ensure that, kids are safe at school once they go back?
Thank you so much. That's a very good question. Now, one of the strategies, as I said earlier, is the digging of boreholes. At least now we are able to provide water in some of the schools that are in the informal settlements where water was a problem. The other thing that I would like to mention is that His Excellency the President has launched a desk project. We are going to start off this project on Friday. We have already identified small and micro enterprise, schemes that are able to make these desks, because we must increase the number of desks in our schools. That is the first strategy that is kicking off right away, so that by January, even as much as we want to space, the desks in our classrooms, of course, they are not there because a classroom has got 40 desks for 40 children. So if we have to...
That is in the best case scenario.
Yeah, in the best case scenario. So even in where now we will increase the classrooms, of course, through the use of the constituency development funds, then the government will be able to provide the desks for the schools. Of course, there are many organizations that are providing us with free masks, like the ones that we have been distributing in the informal settlements. So we are also laying down the same strategy so that we are able to provide reusable masks to our children once they open school. So the issue of desks is being sorted out throughout the country. Water, of course, hospitals, masks, and the others will come as we get along.
Space is also very critical in ensuring the social distancing. And you have a situation like some schools in Kasarani, whereby they have almost 10,000 students. In such a situation, how are you going to control the spaces, yet you don't have any plans to add more spaces in some of these schools? Yes, you're going to add desks, but coming up with a desk does not increase the space, per student.
Correct. There are plans to increase space. Of course, we cannot buy desks without space. So through the Constituency Development Fund, the members of Parliament who are patrons of these funds or other committees are going to build more classes. And of course, the government is also providing more money to be able to improve on the infrastructure that is available. Obviously, we cannot have desks without space. So take my word. There is a plan to increase the classrooms.
So that's a plan.
Yes.
But we are talking about
building a classroom is not really so technical. It
may not be technical, but it is not something.
But the funds are there. The Constituency Development Fund is still intact because they have not been spending the money that is supposed to be spent in the schools since schools were closed. In fact, most of the money that was even supposed to be used for bursaries, they have been asked to convert the same money to do classrooms, so that
have they started, the building of classes yet? I
may not be able to concretely say that they have started, but they are supposed to have started because we are expecting to open the schools anytime soon.
Anytime soon?
Yes.
And anytime soon for you means what duration of time?
January is not very far. When I say soon, it's 3 months to 4 months is soon. With the numbers coming down, obviously every other program is going back to normal.
So when you say that your assumption is that we are going to have enough, or we have enough space for our children, I mean, even before coronavirus, I mean, we had a challenge of space. We had a challenge of schools, in Nairobi County. And with social distancing in place, I mean, this is going to exacerbate an already bad situation. Right. So is it proper to say that we already have enough space?
I didn't say we already have enough space. I said we are going to have enough space. The government is determined to have enough space for everybody with social distancing.
In the interest of time, and what about business sector, and I'm talking about, for example, markets, like Gikomba markets. These markets were not designed with social distance in mind.
Yeah.
And even if they were designed with that in mind, I mean, they have been overrun by time because number of traders, have increased. What are we going to do about, our markets and the thousands of people in them?
Thank you. So you started with Gikomba. I don't know whether you are aware that the government is putting up a market. You are aware? So we hope to relocate some of the traders to that building. Of course, that will reduce the numbers, but it will not meet the need. Yeah. We have another market, Mworoa market, which is complete. We have actually even started the process of allocating of stores. I chair the committee that allocates stores. There are some stores that are for people living outside Starehe, which of course now means they could accommodate some people from Gikomba. That market will accommodate around 350 traders. Westlands market is also complete, and we have completed the process of allocation of spaces at Westlands market. That will also, be able to accommodate more people. There's another market at Karandini, that is at Dagoretti Corner. That market will also accommodate more traders in a very decent environment. You should find time and visit all the markets that I'm talking about. And then when that market was being put up, there were people who were trading there and they were moved to somewhere around Jamhuri, and they have some makeshift structures which are also not very bad. So once we get them back to Karandini market, we will get more people to be trading at the place that they had relocated to. So basically, those are some of the strategies that the government has done to ensure that our people are trading in very decent, setups. Yes.
So there are more markets that are planned.
Yes.
It's a question of funding.
Yeah.
And according to you, you're talking to development partners to see how you can work together.
Yeah.
Very well. What is your message to Nairobians who are watching you and wondering, good Lord, what's the future for us?
My message to Nairobians is that the future is very bright for us. I want to thank them for, adhering to the Ministry of Health protocols on reduction of numbers of COVID-19. But we are not out of the woods yet. I've had many people, saying the numbers have come down, so they are no longer wearing their masks. So please, Nairobians, we are not out of the woods yet. Let's continue adhering to the protocols and ensure that we eradicate COVID-19 totally.
Thank you.
Thank you.
Flora Mworoa is the Nairobi County Commissioner joining us tonight on Inside Government to outline and explain to us some of the strategies that the county administration has put in place to ensure that the issue of COVID-19 is managed accordingly in the city. And of course, the county of Nairobi goes back to business. My name is O'Brien. Thank you for your time. See you again on Thursday. Bye for now.